Good morning, and thanks for joining us today for our Facebook Live, Partners in Student and Staff Health. My name is Rob Spicker. I'm the Assistant Director in the Communications Department, and I'll be leading the way, asking the questions today that you have sent in over the last several days through our Facebook page and also through our back-to-school email address. We have brought together a panel of health experts that have helped the district develop our plan to safely reopen school over the last several months. Their insight and their guidance have been extremely helpful to us, and we hope that by having this panel and answering some of your questions, that parents across the county can feel secure when they send their students back to school a week from today. So joining us today, let me introduce the panel, is Dr. Mary Beth Saunders. She is an infectious disease specialist with Lee Health. Next to her is Dr. Dana Crater, a pediatrician with Physicians Primary Care. From Island Coast Pediatrics, we have Dr. Nicole Bruno. Angela Smith is with the Florida Department of Health here in Lee County. Then we have Superintendent Dr. Greg Atkins as a part of our panel, and our Health Services Coordinator for the district, Beth Whip. Thank you to those of you that sent your questions in early. We'll get to as many of them as we can in just a minute. But first, let me introduce Dr. Atkins to go over some of the safety measures that the district has put in place for the beginning of school. Dr. Atkins?
Thank you very much. And again, I just want to say I certainly appreciate the community tuning in to this broadcast. I think it's very, very important that we stay up to date and keep people informed. And one of the things about this we have learned is that every day brings a new challenge. So it's important for folks to tune in as we adapt our protocols to make sure that we do have a very safe reopening. I also want to say that I just sincerely appreciate that as we've moved forward with this effort, we've had partnerships like these folks up here in this panel. We could not have done it without them. I always am fond of saying I'm an expert in education. I am not an expert in health or medicine, and therefore, when you're facing a health crisis like we are right now, it's very comforting to know that you face it as a part of a team, and certainly I appreciate the fact that this community has pulled together so that we can have a safe reopening. We have literally been working to reopen our schools since we closed in March. So if you think about it, you know, we've been working on this reopening for quite some time. We did have a task force, again, that was comprised of members of the community that helped basically give us recommendations in terms of what we need to do to make sure that we are reopening the right way. We also continue to work on the matter of rapid testing. So we've actually been in contact even with Lee Health as late as this morning on that efforts, and hopefully that will be something that we can bring to fruition in the near future. And then as you see our schools reopening, we'll be doing some things at our schools later this week where, again, you can look at how we are actually going to be reopening social distancing, wearing masks, and all these protocols that we need to go through to make sure our kids are safe. Finally, we do have a safe schools reopening guide and a closure matrix that helps guide our decision making and also, I think, guide our students and staff in terms of what they need to do to stay safe.
All right. Thank you, Dr. Atkins, and you mentioned masks, and that's where we'll begin as I ask the questions. Almost every question submitted to us had to do with the requirement for students to wear a mask. So what we're going to do is begin by asking really each of our panelists for their thoughts about the importance of wearing a mask at school and why that is such a requirement. So maybe I'll just start right at the very beginning, Dr. Saunders, with you.
Hi, thank you. Yes, and I really want to extend my thanks to Dr. Atkins, Dr. Savage, and Beth Whiff because they have been just wonderful partners through all this, and they really did start this work in March. And with this pandemic, things change so rapidly that things that we thought of doing 3 months ago even may not be what we are going to be doing at this moment in time. And certainly 3 months down the road, ideas will change based on CDC guidance. So I just want to tell you that you just have awesome leaders in your community for your school district, and I really appreciate everything that they've done. So we know now that wearing masks and having students to wear masks to protect others from the spread of COVID-19 is so important. And the amazing part of this is that children are so adaptive. And in the beginning, we thought they'll never keep a mask on. They won't know what to do. It'll be all over the place. But we've seen it in our daycares. They put their mask on. They wear them all day long. And they are doing great. In some instances, I think they even do better than the adults. So yes, those important things that we know help prevent the spread of disease: washing your hands frequently, wearing a mask, and that social distancing.
Dr. Crater?
Yes, thank you to all of you very much for having me and inviting me. And I also have been super impressed with the school district's preparation and all of the thought they've put into all of this planning. Just super impressed. Makes me feel very good about sending my kids back to school next week. I just want to say that science does prove time and time again, has proven time and time again, that wearing a mask dramatically decreases the transmission of COVID-19. So it's absolutely the right decision for the school district to require masks. I know there's a lot of misinformation out there, and a lot of parents worry, is this safe for my child? I can tell you from a scientific standpoint, it is absolutely 100% safe. There is no risk to the wearer. As you see me adjusting my mask, no big deal. You just grab it from the side, and the kids will have to do that too, and the teachers. But the science proves that it's very, very safe, and also in areas and states where masks have been made mandatory, we have consistently seen a dramatic decrease in the number of cases. So I think that's important to know.
Dr. Bruno, your thoughts?
Good morning. So yes, I'd like to add on that note, even in Florida and local, as we've instituted mask requirements in many areas, we've seen our numbers decline. So we know that that works. We also know from evidence from other states having gone back to school without masks, those schools very quickly close. So this is the only way that we can safely send our kids to school. That has been proven already, and our probability numbers can safely tell us there's no doubt that that's how we need to do this going forward. I will add an additional note, because I take care of all children in all schools, that some private schools are not masking, and I'm already seeing positive COVID tests from them.
Angela?
So in the beauty of going forth, I just get to reiterate pretty much everything that's already been stated. But in all seriousness, in July, our state surgeon general did issue a public health advisory urging residents of Florida to use a mask whenever social distancing is unattainable. So the school environment is a very good example of that. And I just commend you for taking this step and making it a mandate. I think it'll make a big difference.
And Dr. Atkins, to you, this was one of those things that changed along the way. And why did it, become mandatory?
Yeah, and this is why the input is so important, because we did get input from the experts, and which led us to this decision, and I think it was a really good decision. So I appreciate their support.
And Beth, anything you'd add about wearing masks?
Nope, I just would like to agree, and I appreciate, again, all of your efforts in helping us reach this decision, bringing the science and the medicine behind it so that we are making our decisions based on facts. So thank you again.
All right, this next question, Beth, comes to you. It is about we are requiring medical exemptions as a district for those who cannot wear a mask. Mm-hmm. So what qualifies an exemption? And for parents who are maybe having difficulty obtaining that exemption for their child, if they legitimately qualify, is there something that they can do?
Sure. So we are requiring that parents submit documentation from their healthcare providers if, for some reason, their healthcare provider feels that they have a medical condition that would prohibit them from wearing a mask. That documentation will be submitted to the school, and there will be a committee that will review the documentation and make a decision on best next steps for that student.
And Beth or Dr. Atkins, this question came in about their son's speech, still not clear to be understood through a mask. So does that student get left behind, any student in that position get left behind if they are not able to clearly communicate with their teacher?
I'm happy to answer that one as well. Of course, we will never leave a child behind. We will continue to work with all students in the adjustment of wearing a mask, and there may be different issues with every student related to the mask. It's part of how we're going to educate the students. We're going to reiterate, and we're going to make sure that every student is successful.
And just to add a little bit onto that, one of the things that this pandemic has really forced us to do, but a good thing that's coming out of this is that we're learning how to, I think, educate children in different ways. And so we have had to learn to become agile and flexible. And I think at the end of the day, we're actually going to be better off overall when we're able at some point to get back to maybe a more traditional setting. But all these lessons that we have learned during this period of time, I think is going to make, is really going to improve how we can deliver instructionally in a multitude of different ways.
Another very dominant question, we get asked what is going to happen when there is a positive case identified and how families will be notified about that. So Angela Smith with the Florida Department of Health, maybe you can expect or walk us through what families should expect should we have a positive case in a school.
Sure, absolutely. So contact tracing is a core function of public health. It's something that I don't think a lot of people realize. We do this 365 days out of the year for other reportable diseases. We work very closely with a lot of the professionals up here in doing so. So kind of the nuts and bolts of what'll happen is if a student tests positive, the parent or caregiver will receive a phone call from the health department. We'll do an in-depth interview about the child's symptomology, who they were around, where they've been, and then we'll take all of that information and we'll determine when the child's infectious period is and then deem individuals contacts of that case or not contacts of that case. And part of that includes working with Beth and the school district to quickly get classroom lists if the child was on campus during their infectious period, bus lists, those sorts of things. So the biggest thing that I can say for parents, make sure you answer the phone. If you don't recognize the number and we leave a voicemail, please call us back. It's very important to do this as timely as possible. But that's pretty much the process in a nutshell.
I think the key there maybe for many is that a lot of those notifications of the case and the positive and the exposure come from you, come from the health department.
That is correct. So it is law in the state of Florida that labs and physicians report to the Department of Health any positive case. Actually, it's positive and negative for COVID, but so we actually get multiple phone calls for each positive case. I may get a call from the physician as well as the laboratory that processed the specimen. So we're getting multiple notifications, and then we have a communications plan worked out with the district. So if a family calls, say, Beth or the school nurse or the principal, we're communicating and appropriately getting our arms around that as quickly as possible.
Will the data you have that gets released identify whether it was a student or a staff member?
No, it will not. For privacy reasons, we do not differentiate. People will be notified that they've been exposed to a case, but not specifically who that case is.
Maybe one last follow-up. The intention is for all of this to happen very quickly.
Correct.
Within maybe hours, certainly the end of the day from whenever the notification comes in.
Hours is our ultimate goal so that we're not returning students or faculty to school if they're exposed or ill. And to do so, we have a team of about 10 individuals that are dedicated solely to COVID. And then we also have a team of about an additional 85, 90 people that are able to supplement that.
And Dr. Atkins, maybe I'll ask you this question, but the district has taken a lot of steps in the classroom, in the cafeteria, on the bus to help with this process. Can you explain some of what we will be doing to help the Department of Health?
Yeah, that is correct. One of the things that we have done is we are requiring in every single classroom, of course, a seating chart. So you know where students are seated. We're doing this as well on buses and also in any other areas such as a cafeteria. So we can certainly do that contact tracing. The other thing that we have done throughout the summer is we work to make these spaces we've pulled furniture out and so forth so we can actually spread the desks out so that we can try to maintain social distancing while students are in the classroom, and that will limit the number of students who might have been in contact.
Anything you would add to the notification process for our families?
No, I think that they covered all of it. It's going to be really important for us to report this as soon as we are notified, and so we have a process in place so that we can contact the Department of Health as soon as we are notified so they can begin their contact tracing. So it's a great partnership.
It will work fast. as fast as we can. Yes,
May I add?
Dr. Bruno.
So as a physician in the community, when I'm counseling parents on positive tests for their kids, I'm actually asking them to be completely transparent with everyone they've been in touch with. So school, teacher, bus driver, friends, family, you don't have to go around screaming it, but inform everyone. This is what it is, and if they don't know, they can't take the adequate safety measures. So if you're the positive, I believe it's safe to share that information with everyone that you've been in contact with, and that's the best thing we should be doing.
Let me move to a number of questions related directly to COVID. And this is really for our panel of pediatricians that are here and our experts. So we've had children in summer camp all summer. Some never stopped going to their daycares. The district itself had 250 students in a 12-day summer program. So what has been your experience with your patients? Are there success stories of taking protective measures in these settings that have been working? Maybe we'll start with you, Dr. Crater.
Sure. Just anecdotally, I've seen in our practice, I like to quiz all patients who come in, even if they're not coming in because they're ill, just what have you been doing? A lot of them have been in camp settings, outdoor, indoor. A lot of the younger ones are in daycare because their parents are working. And I've asked, have there been any cases in your daycare? Have there been any cases in your camps? And the majority of the time, the answer is no, there haven't been cases. Or I've heard, oh, there was one case, so then we, they closed for a week, but now we're back open. And I've been really, really pleasantly surprised by that, and it gave me a lot of hope for this upcoming school year.
Dr. Bruno, what have you seen?
Similar. All through the summer, we haven't had too many sick visits. We've done mostly well visits in the morning time. Afternoon is sick, and sometimes we're not full. But of the positives that we've seen, the few, daycare, sports camp, there are scattered cases. So the safety, the reason the kids that have not gotten sick, I feel, are in the safer daycares with the masks on. The sports camps are outside, and they're taking the safety precautions of grouping into separate pods. And so those are all the positive things I've seen that facilities are doing. But yes, it's been low.
And maybe Dr. Saunders, Lee Health, your experience?
Yeah, and I would just say it's really important to continue the important message of if your child is sick or you as a teacher are sick, you should stay home and not go to school. I know especially as healthcare providers and teachers, we're like, we have to be there for our team, and even when we're not feeling so good, we've come into work at times. It's really, the message is if your child is sick, please have them stay home so that they can heal themselves and not expose others to virus, whether it's flu, COVID, or any other virus that may be going around.
May I add to
Yes.
the clarification of what sick means for families right now? Most parents think if their child has a fever, that is the only reason to keep their child home. Unfortunately, with COVID, many children will not have a fever. So any symptom, any abnormal symptom, your child wakes up with a runny nose, sore throat, I would keep them home and watch them. This is not the school will call me when there's a fever and send them home kind of day. Right now, it's my child has any symptom abnormal to their normal functioning, they need to stay home. And if they have allergies, we should not miss a day of our allergy medicine, because that clear runny nose counts as a symptom right now.
Very good, very, very good advice. To all of you as well, this question came in. Are children at less risk of a hospitalization or a death from COVID-19? Anybody?
So the numbers that I looked at, I'm not in the hospital. I go see newborns, but and as far as my patients have been, I haven't had to send many sick kids to the hospital. But the numbers have increased in July of children being hospitalized. So yes, we are seeing an increase in our hospitalizations for children. They're not critically ill, not many of them, but there have been children deaths, about 8 now in the state of Florida.
So would their risk be lesser, higher? Is there a way to categorize that?
I think this is one of those things in 3 months we'll be able to answer your question a little bit better, but we do know that even during a typical flu season, it's rare, but we will see children who require hospitalization or even, childhood deaths related to flu. So that brings us upon our other campaign that's so important, and that is that to make sure that your children do receive their flu vaccine, even more so important this year as we go through COVID.
I'd like to add, please, I think a real take-home is that children are, compared to adults, they are at far, far less risk of hospitalization and death from COVID. We have a very large pediatric practice, and in our experience, since the beginning of this pandemic, the positive cases we've seen, I don't think any of them have had a fever greater than maybe 100.8 or 101, and have barely been ill. You know, most of them either got a case from someone else in their house and were asymptomatic, or had very, 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 very mild symptoms. But that is true if you look at the numbers of across the country of hospitalization rate of children is around, children under 20 years old, COVID positive, the hospitalization rate is anywhere, I believe, between 2 and 4%. At times it's been a little higher, but it's much, much less than adults.
Let's talk about recommendations you might make to families right now as they're getting ready in this last week before school to send their children back. So what kind of recommendations does our panel have for our families that are watching? And maybe I'll start with you, Angela.
Thank you. So to reiterate, influenza vaccine, making sure your child is up to date with their physician's recommendations for all pediatric immunizations. Teaching your child to communicate when they're not feeling well and something's out of the ordinary, and keeping the child home when they are not well. And then practicing hand hygiene, proper wearing of face mask, those sorts of things. So that's all kind of our comprehensive mitigation strategies.
Dr. Bruno, recommendations?
I would add having them practice taking their mask on and off, keeping it on for long periods of time. In fact, tie their screen time, which they have a lot of right now, but they can't have their screen time unless they wear their masks for 3 hours while they're doing their screen time, just to get them used to it. That's the first week is a lot of getting used to wearing the mask. When they take their mask off, to put it face down, to not touch the face. Germs are on the outside. Don't touch this. Touch the sides. Make sure it fits so that it doesn't fall down when they talk, and that it's tight behind the ears. So that's all the mask safety. Also the basic stuff. Don't share your stuff with friends. Hand sanitizer, and don't touch surfaces. Try to just stay in your zone.
Dr. Crater, any recommendations?
I took my children to Target and made sure that each of them in their backpack has a couple of small hand sanitizers. Told them just get used to having it right on your desk. I'm sure the school will have plenty, but so they can also have their own. And a little Ziploc with extra masks in the backpack, so that they have the one they are wearing on the way to school, but they also have an extra supply, as well as educating them about all of the above.
And anything you could add, Dr. Saunders?
Well, I just want parents to remember that masks aren't like gym clothes, so they do need to be washed daily. If you send a cloth mask with your children, and it's not who can wear their mask the longest throughout the school year without wearing it. So make sure that they do have an ample supply of cloth masks that get washed daily after use.
Yeah, we don't want that to become a contest.
No.
No, absolutely not. Good advice. What would you, to our panel, for all of you, believe to be the most important health measures that students could take as they return to school and when they're back on campus? And maybe I'll just work my way down. Beth, would you start?
Sure. So some of the health measures that they can be reminded of during the school day would be to physically distance from their friends, not to gather in large groups. There will be signage, there will be areas in the hallways and on our floors that are good reminders for our students. Pay attention to our new signage that we have available that will help you in those reminders to physically distance from one another. I would also say limiting touching the surfaces and continuously washing your hands throughout the school day would be helpful.
Any important measures on your mind, Dr. Atkins?
Well, just reinforcing that and understanding that when students do come back to school, there's that desire, I know, to get close, particularly when you haven't seen friends for now months, but just to resist that. And everybody needs to do their part to socially distance, wear a mask, making sure you're washing your hands, all those things. Just, again, reinforcing it with our students to make sure that we're following those guidelines, despite the desire to do otherwise.
And to our panel, any important health measures that are in place for students that you would recommend or
Yeah, additionally, you want to make sure they're eating the healthiest food possible to keep their nutrients up, adding their multivitamins, including zinc, vitamin C, plenty of water, and exercise. If they're not playing their regular organized sports, keep them busy. Everyone gets a gym class every day.
So the healthier, the better.
The healthier, the better to stay healthy.
Anybody else?
I'd like to add to make sure that your family is also being careful outside of the school hours. This is going to be a really big change for our community to have thousands and thousands of children going back to school. So we also need to, let's be really careful. The school is doing a lot to make sure our kids and our families and our teachers and staff are safe. So let's continue that safety at home as well. Don't let your child come home from school and then get together with a large group of kids at someone's house. Please try to be really careful, especially these first few weeks and months, so that we can have the most successful opening that we can.
What are the current trends for COVID-19 in school-age children? And maybe, Angela, you start here with you. Are we moving in the right direction at this moment? Where are we?
We are moving in the right direction. Our positivity rate overall yesterday was below 4%, where it hasn't been there in a very long time. And when you look at the pediatric report, that's also trending downward. So we're definitely, I think people are being responsible. We're socially distancing, we're staying home when we're not well, we're wearing the masks. So I think we're seeing the fruits of our labor and that we are moving in a positive.
So the key is to continue that once everybody's back at school. So for our pediatricians in our panel, what does the medical community foresee as maybe the easing up of some of these safety measures? Is there a point where we may be able to pull back? Are there thoughts on that?
I don't think we can really predict this at this time. So Lee Health knows that we're going to have periods of time where we're going to have waves of increased patients into our health system related to COVID. We're preparing for that wave as school starts back. We're hoping it'll be minimal and not, a tsunami. But we are preparing for that, just like we prepare when our northern visitors come down. And we know that we're going to have increased older folks in our community and increased respiratory viral illnesses. So to kind of stage things so the health system can be prepared to take that increased influx of folks who may be coming into the health system, and certainly everything that we can do as a community to mitigate and protect that from happening and not as many people getting hospitalized is always very helpful.
I think what we have found all along the way, there is no magic number. There is no specific point where you can make a cutoff and make a change.
No, not yet.
Not yet. All right, we'll continue to monitor that one. The next question, the degree of exposure can sometimes be difficult to understand. So what are the thoughts about who should be quarantined and for how long? And this may be a Department of Health question. So, Angela?
So I think the important thing to understand is quarantine is when you have been exposed to someone who is a known contact, or I'm sorry, a known positive for COVID. By comparison, isolation is when you yourself are positive and you have been asked to isolate because you do not want to expose anyone else. So there are two separate things, and when we quarantine someone as a contact, it's for 14 days from their last date of exposure to that lab-confirmed positive case. Okay, so that's that bucket of people. Then when we move into somebody that is actually positive, it gets a little more subjective. There's some clinical pieces to that. We're looking at the person's symptomology. If they were asymptomatic, it's 2 days prior to the test result. They're considered infectious, and they're then isolated for 10 days after that positive test result. If they're symptomatic, that's a little different. We wait for 24 hours of resolution of fever without the use of fever-reducing medications, and improvement in overall symptoms, and then 10 days past that positive test result. So it is complex, but there's a lot that goes into deciding who fits what category and what is being applied. And I think physicians are very good at explaining this to their patients. Our staff, the epidemiologists are trained in explaining a lot of this. So if people have questions when they're contacted by the health department, they should absolutely ask those questions of the epidemiologist they're working with, in addition to communicating with their healthcare provider.
I think in some ways that's really what it goes back to. You'll be explaining those in the context that you make, so that's the good time to ask those questions.
Absolutely.
And to understand exactly what you're being asked to do and why.
Absolutely.
Yes. Also, this question in a similar way, that many children may have symptoms that mimic or overlap with COVID. So as pediatricians and health experts, how will you differentiate that so that students can return to school sooner because it is something else? Would you like to start with that one as well, or?
So we don't ever break quarantine. Quarantine, when you're a contact, your incubation period is 14 days. So we're not ever going to get a note that is going to change that. You are at risk for developing COVID for 14 days, and that's end of story. And then I'll defer to the pediatricians for some of the underlying conditions and how that works.
So if they have, you're saying if they have cold symptoms, how do we differentiate that from COVID without a test? We can't. It's really difficult. I'm working on getting rapid tests from my office so that I can determine that better in a more rapid fashion. But that will still be a few weeks away. The machines are not all available. So the best advice that we've gotten recently from Golisano Infectious Disease in the hospital was 10 days from the start of your respiratory symptoms is when you should return to school. And that is COVID or not COVID. That is presumed COVID until proven otherwise. We have had some resistance in testing. People don't necessarily, oh, it's a cold, I'll see what happens. If I get a test, I have to quarantine. So, there's a lot of stigma, and parents are worried about actually having the test. It is better to know so that you can plan your life for the next 14 days. But if you don't know, you are still staying home for 10. So that's kind of that's the advice we're giving right now. And it's hard. It's difficult, but it's, as I said, any symptom keeps you home, any symptom.
It's going to be very important. If you're sick, stay home. Dr. Prater, any thoughts?
I think to give people hope, I think we are heading towards an era and a time where rapid testing is going to be more and more available. I know our office is getting a lot of rapid tests in the next couple of weeks, and so that's really going to help. I agree with everything Dr. Bruno said. And so as hard as it is, if your child has any symptoms, they have to stay home for 10 days. However, if you can get them tested, if you can get them to your pediatrician and get them tested for other illnesses as well, if we can rule out other things, including COVID, they may be able to return sooner. It's a case-by-case basis.
Just remember, so COVID you can have other infections at the same time that you have COVID and have flu. And the testing is not perfect, so it doesn't always detect people who may actually have COVID, depending on where they are in their disease, or maybe their main symptom was diarrhea. So it's really that message of, if your child has symptoms of COVID, which include those diarrhea illnesses, that they're sick, they're going to be isolated away from other children and maybe even their family for that 10-day period. Now, if you are the person who's exposed to someone who's sick with COVID, you're going to be in quarantine, and as Angela said, that's 14 days. I'm in quarantine. That is a 14-day period, because you can develop symptoms anywhere from day 2 to day 14. So for parents who say, okay, my child was told they're on quarantine from school because they were exposed to another child with COVID. So their child is on quarantine for 14 days. What does that mean for the mom and dad who need to go to work? Well, they're not going to be on quarantine because their child's on quarantine. They're going to only be in quarantine if their child would get sick and require isolation or be on symptoms. So it's kind of like the cousin of the cousin. If your child is on quarantine, you are not on quarantine. You can go to work and do your daily functions, but you still need to watch your child for any symptoms that they might develop to suggest that they do have COVID. And really during that time, when possible, for folks who do need to continue their daily activities, going to work, et cetera, they may need to isolate away from that child in case they do develop symptoms. So that's where it's important that, collaboration of caregivers for children.
That leads really right into the next question is, what if a parent has tested positive for COVID? Does the child quarantine? What about their class? What happens with the class or the students that they mix with because the parent has COVID? Is there a process here?
Well, on the reverse of what she had just commented on, if the child is positive, the parent, so the child doesn't have symptoms, had an exposure, the child stays home, the mom can go to work. If the child is positive, now mom has to stay home too for 14 days. And same reverse setting, mom's positive, the kid also has to stay home. They're in a quarantine bubble together. The household contacts are the highest risk for sharing it. So unless you can clearly keep them in their own side of their house, they're a teenager, they don't want to leave their room anyway, then you're in good shape. But if it's a 2-year-old, you're not going to be able to avoid your child. You can wear a mask in the house. That is an option.
So we are a week away. The four of you that have joined us today, if you're a principal, what would be the one health and safety measure that you would want to implement? What would matter the most?
I think Dr. Adkins has taken care of it, the masking.
The masks.
The masking.
Masks.
I would say slow introduction, which has happened naturally. Parents have chosen to do some homeschool. 40% are going back, 60% are virtual. This is a good ratio. We can safely space that way. And then we can add more kids back. And I think that it's just happening naturally the way we're doing it, wearing the mask. And then, of course, mental health. This is very stressful for parents, teachers, and these children. And the kids absorb our energy. So we have to try to deal with our mental health and stay healthy, and give these kids an outlet and really check in with them, make sure they're doing okay.
Dr. Crater, I heard masks. Was there anything else, or was that it?
I think mandatory masks, of course, I agree with Dr. Bruno as well, but I think mandatory masks, if I had to choose one thing, is the most important.
Dr. Saunders?
Wash your hands. There'll come a time when hopefully we don't have to wear masks anymore, but getting that message and really, highlighting that message in different ways throughout the year for children to become just awesome hand washers. And I know COVID has done a lot in the healthcare field to help healthcare providers become better hand washers and really cognizant of that. So hitting home that message continuously, because that's what protects us during flu season, during norovirus, is that good hand washing.
Good advice, all. This was a question that had to do with social distancing, and maybe Dr. Atkins, I'll direct this towards you, but how are students going to be able to social distance if you have, say, 20 to 30 students in a classroom?
Well, one of the things that we are doing as we're putting our schedules together is making sure that we are actually decreasing the number of students in classrooms so you don't see it at 20 or 30 kids. So that's one of the things that's created so much work right now with our schedulers is moving more of our students, creating a little bit larger class sizes with the Lee Home Connect so that we can have smaller class sizes in school in person. So you might have maybe an additional in-person class at a school with smaller numbers, and then a less number of Lee Home Connect class or connected to the teacher. Those class sizes will be larger so that we can socially distance.
And a social distancing question as well. This came in from a parent in particular that they have twins, so they wonder if their twins need to social distance. Then I'll broaden that out to family members, because obviously we're going to have some children of the same family in several of our schools. So twins social distancing, siblings social distancing.
I can speak to that. So when they're in the school setting, yes, we are expecting every child to follow all of the rules. Even if they're siblings, we are asking them while in the school building to please physically distance and to follow all the guidelines that we've set into place.
And at home?
At home, you're at home, so.
You're back in your family unit.
Right, and if someone's ill at home, I believe Dr. Bruno was mentioning this, is that you want to separate yourself as much as possible if you can, if you have other caregivers that could step in and help. But we do understand in a family situation, you are in close quarters and you are together a lot. So we do understand that piece, and that's why we will be looking at the family setting if DOH notifies us that there are positive cases or if they determine that students must quarantine due to a family setting.
Dr. Atkins, I'll direct this one towards you that came in with all the safety measures that we are taking. This parent asked us, how can we have fall sports if we're going to have our students wearing masks? We're going to be socially distancing. Those aren't things that happen in an athletic competition. So how do we have fall sports?
Well, you also have safety protocols that apply to the different sports. So, for example, with swimming, I'll just use that as an example. So, normally under the circumstance where you're doing practice, you're going to have multiple people in lanes, going up and down the swim lanes. But in currently right now, you would only have one person per lane, and you would space out. It is in an outdoor setting, so you have a lower risk outdoors. You can certainly social distance, and we'll be doing that. So if you are not participating directly with the activity, you'd be on the sidelines with a mask on, socially distanced. So the measures, I think what's important is as we're doing these practices and we're playing these games, that we continue to follow the protocols that we have. One thing that I can add is that we've been able to watch over the course of the summer as our athletes have been conditioning, and while we have had a few positive cases, it's been very, very small in terms of that number. So we're encouraged that students have been able to stay safe over the course of summer while participating in athletics.
This was sort of a general question to us at the district about how are we protecting the health of some of the most vulnerable children that will attend our schools? Who's looking out for my child if I have that child in my family? So what is the district doing to protect the most vulnerable?
Well, I think one of the most important things here is that we have provided options for parents. So if we have a situation where you have a vulnerable child, I think one of the distance learning options is probably something that someone should avail themselves to. That's what I would recommend in most cases. In a case where a child is in school, again, that's why we have all those safety protocols in place, the social distancing, the masks, the washing of the hands is again to reduce the spread. But if you do have questions, I would encourage you to reach out to your medical experts in terms of what would be the best advice and best instructional model for your child if you have a child that's medically fragile. And
a question as well was about after-school care, and how is that going to be handled? Beth?
Sure, I can speak to that. So we'll be following all of the safety and health guidelines that we've implemented during the school day. We will be implementing those for our before and after school care as well. So we will be doing a lot of training with our staff to make sure that they understand some of the new rules and some of the new guidelines that we have to implement due to trying to keep all of our students and our staff safe.
And let me just, really is the most of the questions that came in, and we thank you everybody for sending those in. So let me just go down our panel and sort of give you a closing argument, a final thoughts about keeping our students healthy, our staff healthy, our families healthy when they start school in a week. Dr. Saunders?
Well, I just want to remind people, as I think Dr. Bruno had alluded to it, to stay well hydrated. Your children are going to be wearing a mask a lot during the day, and as well as the adults. And people don't think about drinking and staying hydrated, so it's important. Stay hydrated, get your flu vaccine, and wash your hands.
Dr. Crater.
I would like to point out that if all parents could remember that children typically mimic the attitudes and emotions of their parents. So if parents could try to be as positive as possible and really talk up the excitement of going back to school and the importance of wearing a mask, washing your hands, and watching your distance in a positive way and not in a disparaging way, I think that kids will really do way better than we often think they will, and they'll embrace it with a positive attitude.
Dr. Bruno?
So I agree with both of them. I'll add to the flu shot. I've been counseling people that have never received a flu shot before and begging them, please get your flu shot. But the point I really want to make is if kids get sick with the flu, their immune system is already lower, so they can get sicker with COVID. That's how they are related. We're not just pushing the flu shot because we want to. This is a real issue that we really have to address. So those are the reasons behind it. Just wanted to make sure everyone understood that.
Angela?
So I'm going to agree with everything that has previously been said. I'm going to take that up a notch. All childhood immunizations, making sure you're up to date, making sure that your child is familiar with the strategies, the hand washing, the masks, As you mentioned, the co-infection is such a huge problem, and I cannot imagine us having to contend with a measles outbreak on top of COVID. So just stressing that importance to receive all the necessary childhood immunizations.
I'll give Dr. Atkins the last word, so let me skip over to you, Beth.
Okay, sure. I just would like to let all parents know that we are so excited to welcome your children back next Monday. We have been working so hard at the district and with all of our community partners to make sure that we have a safe and healthy environment for them. We are just really looking forward to welcoming back. We want to make sure that we partner with our families in all the suggestions that were made here today. Keep your kids home if they're sick. Please let us know if there's anything at the school level that you need and how we can help. We are here to help. So I just want to say we are really looking forward to next Monday.
Dr. Atkins, last words.
Well, I can't say it better than that. I am truly excited about August 31st as well, getting here. The first day of school is always one for excitement for me. I look forward to it, but this one in particular, since we've been so many months without seeing our students in our schools, you know, I'm in particular looking forward to this one. I think it's going to be special in a good way. The last thing, though, I do want to tell our parents and community is stay in touch, in contact with the school district, monitor communications that we are sending out, whether it's text or phone, on the internet. We want to stay in contact with you about contact tracing, which is, of course, the Department of Health, but also about positive cases that we have in a particular school or any changes that we need to make in our protocol. So it's important for us to continue to be available to each other so that we can keep that communication line open.
Thank you, Dr. Atkins, and thank you, everybody on the panel, for being here with us today and hopefully helping reassure our families that they can feel as safe and secure as possible when they send their children back to school. We hope those of you that are watching found this helpful and reassuring. We're going to keep this right here on our Facebook page, plus it's on our YouTube page, the district's YouTube channel, so that you can watch later at your convenience. Maybe let your family and friends know that couldn't join us at this hour. As Dr. Atkins says, as a district, as our schools, we're always available there to answer your questions. So please reach out and keep in contact with us. And we do look forward to seeing you and your students with school beginning next week. Have a great afternoon.